The Ebola outbreak was one of the most difficult periods for the World Health Organization. That's according to Margaret Chan, who has retired as the Director General for the World Health Organization. Dr. Chan is one of China's most senior figures in UN history. She has served the World Health Organization for 10 years and led the global response to outbreaks including Ebola and Zika. She spoke to CGTN's James Chau.
3 countries in West Africa that experienced the most horrific Ebola outbreak in history. What do you remember of that time personally?
I mean, Ebola outbreak in West Africa is one of the most difficult periods for WHO. And we've been criticized for being slow at the beginning. And of course, after the slow beginning, we make course adjustment, and then we support countries with the help of partners to contain the outbreak. Not only did we contain the outbreak, we also worked with scientists to develop the first ever effective Ebola vaccine so that future outbreaks would benefit from this innovation.
I mean, it's incredible to think that there is a vaccine for Ebola, a virus, a disease in parts of the world that, quite frankly, a lot of people didn't care about for a very long time. Now that there is a vaccine, do you think it sets a template, a mandate for, say, maybe cancer, heart disease, AIDS even? Do you think it shows and renews hope in the possibilities for science and medicine everywhere?
Now, it is important you raise this point. You know, when we look at Ebola in West Africa, it has many lessons for the international community, for the countries, and for United Nations agency as well. First and foremost, you know, these 3 countries were post-war and post-conflict countries. When you don't have stability, you can't even begin to talk about development, let alone health development. So without a healthy, resilient, and functioning health systems, it is a big minor. Because, you know, you can't detect early signals of trouble. So I always believe, and I've been championing the importance of health system and making sure that no one is left behind through the universal health coverage. Now, another dimension you talk about is, what about innovation? Oftentimes, you know, far too many companies, pharmaceutical companies, they invest in products that can bring a benefit. And far too many diseases are affecting the poor, the poorest of the poor. These are people, no matter how affordable those innovations or interventions are, they could not afford to buy them. So what is the solution in a world of poverty, where people are disproportionately suffering from diseases of the poor? So W.H.O, working with partners, we promote innovation, develop new diagnostics, new medicines, and new vaccines. Not only research and development is important, we also advocate access to affordable innovation. Let me give you an example. The world took about 10 years to reduce the price for HIV medicine. That was a tremendous success.